there, I'm Jamie Taylor. Welcome to Your Health Matters, brought to you by Kingman Regional Medical Center, your community-owned, not-for-profit hospital. I'm excited to have this program to be able to share with you programs and services we have here and the healthcare providers that will help you deal with your health issues. As we all know right now, everyone's facing challenges with healthcare, whether it's your insurance that's being cut, if you've lost your coverage from Access or Medicare being cut. There's a lot of scary things out there right now. Now more than ever, it's important that we all take responsibility for our own health. We have a special part of this program as well called Medical Edge that are videos presented by Mayo Clinic, a partner of Kingman Regional Medical Center. I think you'll enjoy today's show. My guest is Joe Stevens, a case manager with the KRMC Cancer Center. So stick around, we'll be right back. Welcome back to Your Health Matters. I'm Jamie Taylor, and my guest today is Joe Stevens, a case manager at the KRMC Cancer Center. Welcome to the show, Joe.
Thank you, Jamie. I'm happy to have the opportunity to be here.
Well, we're excited to have you here. We're going to be talking today about self-image and dealing with cancer. Of course, cancer is a scary thing, no matter what the circumstances that are under, and I know that you work very closely with patients that come through the KRMC Cancer Center. What brought you to the Cancer Center in KRMC?
Well, I have been in the community for almost 20 years.
Oh, I didn't know that.
And 16 years of that were spent working at a local mental health clinic. And I became interested in the medical aspects of therapy and treatment. And that led to acquiring a position here at the hospital, which led to employment at the Cancer Center.
Okay, very good. So I didn't realize you'd been in Kingman that long. Very good. And where did you come from before that?
Originally from North Carolina. I was born and raised in North Carolina.
Okay.
Went to school in Kansas and moved out here later in around 1990.
Okay, so you've seen some changes in Kingman in 20 years. Kingman's changed a bit, hasn't it?
It sure has, and it's been good, I think.
Good. Well, we're glad to have you as part of the KRMC team of healthcare providers. That's awesome. It's good to have you on our side. We're going to watch a video here just real quickly from the Mayo Clinic. It's called their Medical Edge program, and it talks about dealing with cancer and your self-image. Let's watch it together.
Okay.
Battling cancer is not easy. Treatment often involves chemotherapy, the side effects of which can be tough. Fatigue, nausea, hair loss. For many people, losing their hair is particularly stressful. That's why Mayo Clinic teamed up with a hair and skincare salon. They specialized in helping cancer patients keep a positive self-image as they go through treatment.
My first visit was very emotional. I walked in the door and I started to cry.
Jackie Overland says it took a lot of courage to step into this salon to get fitted for a wig.
That's when the reality hit me. Yes, I have to go through chemotherapy. I am going to lose my hair. I'm going to suffer all the side effects. I'm going to be sick.
There's even times where just making the call to make an appointment is a big step for them, and it's very hard.
Ann Richards is the supervisor at Erickson Skin and Hair Care Center at Mayo Clinic. She helps patients like Jackie with wigs, hats, scarves, even makeup.
Yeah, that looks really nice with the outfit you have on. That looks great.
Oh, it does. Look at there. I didn't
know.
even plan that.
Yeah.
But what happens at this shop goes much deeper than just giving tips on how to wrap a head covering. It's about listening, sharing, and offering strength when the journey overwhelms.
And now I have to have a hug.
And I'm going to drip my tears on your jacket.
That's all right. That's okay. Our goal is for the patient to walk out and say and have that I can do this attitude.
I think attitude is key.
Yes.
And I just decided that I was going to be okay. I am okay, no matter what happens to my body. I am okay inside.
Right.
And Jackie says with the tools she gathered here, both physical and emotional, she's feeling okay, more like herself on the outside too. Ann says it's very common for patients to struggle with losing their hair, but the people at shops like Erickson's can help make the experience a little easier. For Medical Edge, I'm Vivian Williams.
So is that fairly common? I mean, you think that self-image is a major influence or whatever with cancer?
It's critical.
Okay.
In both men and women, when they enter treatment typically there's the treatment like loss of hair, loss of other ability, activities. A lot of people struggle with that, and it's a big piece of having to learn how to deal with that. It's important to learn and have a good attitude about about treatment and going into treatment, because that helps maintain your body image through all the difficulties that one might occur.
Well, and I've heard, it's very common, you hear the saying about positive attitude affects the outcome.
Yes.
And obviously, when you're dealing with cancer, which is so scary anyway, having that positive attitude about yourself and the team that you're working with to help fight the disease is very important.
It's, I always tell folks it's about a third of treatment, and the reason being is that a positive attitude is important to help learn skills as you go through diagnosis, treatment, and beyond cancer to maintain a good, healthy view of yourself.
Right.
And a good, healthy view of your image and your body image and your esteem, because all those are affected for some people very intensely. And so I work very closely with folks when they come in and monitor them throughout the process.
So you're pretty much there from beginning to end as they...
I am. I meet, when they come in to meet with the doctor, I meet with them after that doctor's appointment and let them know what I do and what kind of services that I can provide. And then from that point on, I'm with them all the way through follow-up.
So when you say what you do and what you can provide, what is that?
Well, I provide everything from counseling to resources and information. And I'll start out by first saying that when a person comes in, a lot of times they're so overwhelmed, especially when they have a diagnosis of cancer, about the financial resources, how it affects the family, transportation could be an issue. So what I do is an assessment of any barriers as far as a resource issue that might get in the way of them getting treatment, and then work on setting those up and doing some problem solving around them for them. The second thing is information. Any kind of information a person wants to increase their understanding of or have about cancer, the diagnosis.
What they're going to be dealing with and what they're going to be going through.
Exactly. I usually give just a broad overview. The doctor, of course, gets into all the specifics. But anything leading to information, some people have access to the internet, some don't. So I'm there to provide them as a kind of a resource that they can access information related to what they need. And then the third thing is I provide therapy and counseling. It's probably a big part of the job that I do. From diagnosis on, there's all kinds of different sets of new emotions and things that happen. Obviously, you can imagine if somebody's diagnosed with cancer, it's a tremendous impact on the family or a couple.
Yeah.
And then at that point, when that's somewhat dealt with and we might move into treatment, such as this lady in the film, what happens is that a lot of times, especially in our society, most people like to feel healthy and look good, and hair's a part of that.
Right.
And so losing that can be a significant loss for some people. So, for example, this lady, the service we might provide is if a person's doing chemotherapy, they may lose their hair between 1 and 3 weeks of treatment.
Oh, can happen that soon.
It can. And then after treatment, they may gain it back 3 to 10 months. So it's important to let them know kind of what to expect and what's going to happen. And that it is a temporary situation.
That's good, yeah.
But one of the ways we may deal with that is, say for example, if someone has long hair, it can be pretty tough to comb your hair one day and have this big clump fall out.
Oh, yeah.
So we talk about dealing with it, say for example, in stages. Like, why don't you try cutting your hair if you're okay with that? Maybe a summer cut, and then when the hair loss comes in, it's not as dramatic.
Right. Well, and we have resources. I know that the Kingman Cancer Care Unit that works with them, that helps provide funds and wigs, things like that. And they also have funds available for helping with medications. I know they're a great partner for KRMC in our battle with cancer and for our patients.
They do a fantastic job, and enough can't be said. They help, like as you said, with wigs, medication, transportation, any of the gap areas that we sometimes have a difficult time filling. They're always there to help us out.
That's great. It's really kind of a team approach. Has been what I've seen in the community when we battle cancer, and it's the KRMC Cancer Center, obviously, where the treatment is taking place, and then the Cancer Care Unit that helps with that financial kind of side of it. And then, of course, we're also partner very closely with American Cancer Society, ACS, because they do a lot more with education, obviously with research and development, trying to find cures and that type of thing. And of course, Relay for Life is grown to become a very big event here in Kingman. Yes, and I know we've got a great team from KRMC that's out there every year now. That's super.
We have a fun time.
Good, and we're raising money for a good cause, and so that team approach, I think, is one of the things I'm always proud about at KRMC, that I see in all aspects of our healthcare.
That's true. And if I can highlight one thing that I think is awesome, besides the community resources, the Cancer Center itself is a comprehensive center. By that I mean we do radiation, they do radiation and chemo. But I think everyone in this community has a great resource as a team, because we have my role, which is the patient advocate, which provides a lot of different services, and we have a dietitian. So we treat the whole person.
Great.
And I think that's just amazing to have that kind of resources here in Kingman from the hospital.
Right.
And treating the whole person is really, really critical in a diagnosis and treatment of cancer.
Right. Right.
So it's just fantastic that we have that resource here.
Yeah. When I know one of my first roles here at KRMC back in 2004 was to do the ribbon cutting for the Cancer Center when we first opened it. And I, at that time, said what an awesome gift this is to our community to be able to have this full service, if you would, Cancer Center here for patients, so they don't have to leave town. Because to me, it's bad enough when you get sick, and then the treatment's going to make you sicker. And to have to be in a hotel room surrounded by strangers, you don't have your family and friends nearby, that just makes it even worse. And I can see how that would so totally impact your, just your feelings about what you're dealing with,
Well, and not only, my role too, working with the family, it's also working with the treatment team. I want to make sure that everybody that comes through for treatment gets their questions answered and make sure that their needs are met. And how we do that is by first meeting with them and finding out what those questions and concerns are. And so I'm a liaison to the whole team. I also, as an advocate, work with the patient. Any concerns they have, concerns that didn't get expressed maybe, then we make sure that they get with the doctor or whoever that would be to make sure that their needs get met and their questions get answered. That is critical.
And it is, like you said, that full team, because we have both the radiation side, the blood side of it, and I don't always get my medical terminologies right there, but I know we have our new oncologist, Dr. Nagel, that has just joined us, and I think she'll be on a program probably in September. We'll be watching for her on the show as well.
And I sure hope folks get to see, to listen to her. She is fantastic.
Great. Well, we'll talk a little bit more about that in our next segment. So thanks for being here today, Joe, and I hope you all stick around for the second half of Your Health Matters.